My name is Linda Johnson. I'm the program coordinator with the Brava NJC program at Capital Health System. And my guest this evening is Dr. Charles B. Simone with the Simone Protective Cancer Institute. And we left off talking a little bit about some of the herbal things and medications to help BPH.
That's right, the benign aspect.
Benign prostatic hyperplasia.
Hyperplasia.
So, Dr. Simone, I know you're anxious to and I'm going to let you hold that up. You have a chart there.
Yeah, the chart is a very interesting chart. The number of new cases of prostate cancer has risen dramatically in the last 40 years. We now know that 1 of every 6 men in our country will develop prostate cancer. It's an outrageous number when it was only 1 in 20 just 40 years ago. So it's an important thing to get a hold of and watch over. How do we best detect it?
Okay.
Well, the digital rectal exam is probably one of the earliest ways we've done it, and it can detect about 30 to 40% of all prostate cancers. Now understand, when you do a digital rectal exam, you put the finger in the rectum, the doctor does, and feels one small surface of a very large gland. So you're feeling one surface. The majority of all of our cancers live down in that one surface area, luckily for us, and so we can find about a third or more of the cancers that way. It's not terribly reliable. It depends on the person's own technique, how much expertise they have, and it doesn't extend life as much as we think it does. What do we have else? We have PSAs, the blood test. 20% of people with a level of 4 or less have a cancer. If there's a change of about 3/4 of a point per year, it could suggest a cancer. So it's important to go from year to year and know if the rise is more than 3/4 of a point. If the free PSA is less than 25%, cancer is unlikely. And the PSA is also the major screening tool together with the DSA.
So they kind of go, excuse the pun, hand in hand.
Hand in hand. But the problem is, overall, it can detect cancers to a tune of about 40%. So 60% of the time, it doesn't find the cancer. And like a mammogram, the man goes away with a negative digital rectal and a negative PSA and feels good about it. They feel protected from the exam. But it's not to say they should go away and not do anything about their lifestyle. You can still prevent disease from occurring a la our 10-point plan.
Okay, so the other part, you bring me to a wonderful point in the program, because how effective, I know, because I deal with cancer every day, that screening is one of our most effective tools. We're never going to find it 100% of the time. We know that.
Right.
But for the most part, the earlier we find any cancer, is that
better.
Still the rule of thumb with prostate?
That is. Now, we have developed together with the National Cancer Institute and the FDA, together we wrote papers published in 2002, a proteomic pattern, which is a simple blood test looking at 20 and 30,000 different proteins instead of the single one. That seems to be finding it sooner than our PSA, sooner than the digital rectal.
Now, how soon before something like that test? I'm not going to hold your feet to the fire, but how soon might we see
I really don't know. It's in the public domain, which means the government owns it, so they're in control of it, so they need to get it out when they can.
So might we see something like clinical trials?
Clinical trials have been done.
Oh, okay.
So we're ready to go. It just has to be put out there commercially.
Okay.
Yeah.
And I
That's
love
exciting.
That is exciting, because the other part, for those of you who are listening, I know, Dr. Simone, you've been involved in that in some regard.
That's
so, hey, he's right here in Trenton, and that's good to know that we have somebody who's kind of on the leading edge here. So what do experts say about screening? Is there a general consensus?
Screening,
to me, it's worth it.
Screening should continue.
Okay.
Especially in very high-risk people, especially in people who have a high-fat diet, who are African-American, who drink, who smoke, who have a sedentary lifestyle. All these are major risk factors for this very disease. So if you are in that category, you should certainly be screened no matter what. African-Americans should begin screening 35, 40. Caucasians, 50, 45, that kind of thing. PSAs, let's talk about some numbers.
Okay.
If you have a 7 PSA, it generally is a benign condition, not a cancer, even though it's above 4. And that's not true for African Americans, though. If it's around 12, it probably is a cancer, but confined to the prostate gland. If it's greater than 10, 75% of the men with a PSA greater than 10 have cancer. And if it's greater than 100, the cancer has probably spread from the gland into the rest of the body.
In most of these men where you might see these numbers, although I know not necessarily so, but are we going to tend to see the higher numbers in the older man?
That's always the case, only because as we get younger and younger, older and older, we find more and more prostate cancer cases simply because of the aging process and the high-fat diet throughout a life, etc. How should you establish a diagnosis? You can't just rely on digital rectal and PSA. You must do biopsy. So 6 to 12 biopsies are the important number to do at a good place with people who do them all the time, and then send them out for interpretation pathologically. So those are the important things. How do we treat a localized cancer? Because I think we should talk a little bit about that. In 1995, over 12,500 papers were published and reviewed by the prostate panel of American Urological Association. So the urologists of this country reviewed over 12,500 papers, and they found that not one treatment was better than another.
Okay.
For instance, if you observed the cancer and did nothing for an early stage cancer, there essentially was no difference in lifespan, as you can see on this graph, and the cost was virtually nothing. If you did a radical prostatectomy, again, the outcome was about the same, but a tune of about $20,000. If you did radiation of some kind or another, the cost ranged from $12,000 for an external beam to seed implant for about $13,000 to IMRT, which is the new kid on the block, for a whopping $46,000 with no real change in lifespan. That's the key thing. Can you do something to a man or a woman and change the lifespan of the patient? So far, not. And again, 12,000 papers, 500 reviewed by the Urological Association. Cryotherapy, etc., no real change. But when you change the lifestyle, when the people comply to a low-fat diet, high fiber, vitamins and minerals, watch their no smoking, no alcohol, etc., they live longer as per this graph. So the important thing is, early prostate cancer, you can have lots of choices. Each choice will give you the same outcome unless you change your lifestyle, and then you will increase your lifespan.
Now, you talked about some of the treatments there with the seeds and the hormone treatments. Are there many side effects with these?
There are lots of side effects. Doing nothing, obviously, you have no side effects. Radical prostatectomy, radiation therapy, leaves a man generally impotent, sometimes a plumbing nightmare, if you will. Lots of side effects, which we go into in our book. But each treatment is not without side effects. Every treatment has a problem.
Now, does it depend on the advance or the stage of the cancer? Can that make a difference?
We're talking only about early stage disease confined to the prostate. So when you look at that group of people and do surgery or radiation or something like that, cryotherapy, there will be side effects no matter what you do to the man. Now,
I know most of the men that I speak with, it becomes a do I do it or do I don't?
Right.
And a lot of it has to do with what I always refer to as this male thing.
That's true.
And my thing to the guys out there and ladies, I'm going to share this with you. I'd rather have you with me and be here than to not be here with me. So the early detection is always key.
That's right.
And
then be proactive. Take responsibility and change your lifestyle, because there are studies, Linda, that have shown if you change your lifestyle and go onto a very low-fat diet, you will have that PSA drop down.
Now that's interesting because for someone who has been diagnosed with high cholesterol, I thought I was just going to die having to change my diet or my lifestyle. I pulled all the information I could on the diet and said, hey, I'm not doing that bad.
That's right.
So
it's doable. It's easy.
It's doable. And I think one other point I want to bring out, though, that I found that I need to remedy is more exercise.
Well, we all need to do that.
I know you go over that, but I'd like you to again with the Simone 10-point plan, because I truly believe that I looked at the diet and said, what am I doing wrong?
Yeah.
And when I looked at it, I was probably missing that point number 4 there that
Yeah.
said exercise.
You need to do some exercise. We all hate that word, so I don't use the word. I
Okay.
use the word walking.
Oh, I love
So
that.
we can do walking. All of us can walk. We need about 20 or 30 minutes uninterrupted time. Not 10 minutes and 10 minutes, but 20 or 30 minutes uninterrupted time of a brisk walk. Not to look at the daisies, but to keep walking, move along. When you do that, you enhance the immune system, and you start breaking down things like sugar in the bloodstream, cholesterol in the bloodstream, triglycerides. You start to bring all these evil numbers down into normal range. When that happens, you stop feeding the tumor.
Wonderful. Now, I mentioned before that on Saturday, September 29th, for all of you listening out there, I will be doing screening from 10 a.m. to 2 p.m. here in Mercer County at the Family Health Center at Capital Health System, and that's at 433 Bellevue Avenue. It's free. All I ask is that you register, and that's only so that I can make sure I have enough people there to serve the people. Last year, I'm very pleased to say, and you should all be very proud, there were 47 men. The registration number is 609-815-7188. And in case you don't get it, call the Mercer Hospital number, Capital Health System Mercer Campus number 394-4000, and just ask for Linda Johnson and I'll get you registered. Now, one thing that we always like to go over before we leave, and since I've got you here, Dr. Simone, this is September Prostate Cancer Month, but we're moving our way into breast cancer.
That's right.
And you all know I'm going to hit it hard in October. But we're planning the Sisters Walk for the city of Trenton. And since you brought up exercise and walking in particular, and our goal is to get 500 walkers in the Trenton area out there at Catwater Park on October 20th. But I wanted to bring this up since we're on men. Men and breast cancer. I know it's prostate month, but if you could just make a comment
I will.
quickly about.
After age 40, most men start to have enlarged breasts, especially the left breast. But about 4,000 men a year develop breast cancer. And most men miss it. Many doctors don't look for it. Men can get breast cancer, and it's treated the same way as women.
Okay, so, you know, I don't want to scare you guys out there, but let me just say this, because I remember when I told my son, my breast cancer happened to be a male, from a male member in my family. We have that gene, and it can happen, so we do need to be aware of this. And I think the thing I love about having you on here on the program at WIMG is that you take such a holistic approach.
Have to.
Because you talk to men, and while you're talking to the men, you're talking to the women, and while you're talking to the women, because we're all in this together.
It's a team approach.
Okay? So the truth about prostate health, prostate cancer, prevention, and I also want to say, I don't have much time left, don't forget about September 29th, and I want to congratulate the barbers at Cutaway Barbershop.
Congratulations.
Dr. Simone
Very
was up
nice.
there with us, and we screened 11 men in the community, and Cutaway is receiving the Barber of the Year Award up in New York on
Congratulations
Friday.
to
So
that.
congratulations to us all. Thank you, Dr.
My
Charles
pleasure.
Simone.
Thank you, Linda.
And I want to thank everyone for joining me. This is WIMG AM 1300 and WZBN Channel 25 in Mercer. Thank you.